And this hazard ratio is a measure of risk. And the first quartile, this is the people with the lowest arsenic. This Q1, where it says Q1, is the people with the lowest arsenic in their urine, which matches the water. And the standard from the US, and now we have is 10. So this is the fourth group, where people who were drinking 15 and higher, with higher levels of arsenic in the water, there is a higher risk. So we call it, and this is cardiovascular mortality, we can think that arsenic is like a silent killer. It's a toxic agent that we don't see. It's in our water. It's very hard to recognize, but it's making people sicker, unfortunately. I mentioned you the Stronghorn study was the first study. A few years later in Colorado, rural Colorado, they found exactly the same thing. So it's not only Stronghorn. And when we look at cancer, because arsenic has been known to be a carcinogen for a long time, we also found higher risk of lung cancer and higher risk of pancreatic cancer. So these were bad news in the sense that they identified risk factors for disease, but they are good news in the sense that those are preventable. We can do something about that. There is no need to have arsenic in the water. We can remove it. And that's, it's very powerful information. Scientists often want to know why. Why is this happening? Why do we have why is arsenic bad for us? And so one of the mechanisms is that it affects gene expression, which genes are turned on and off. And this is very, very important about how people get sick, is how are our genes working? And arsenic can do this. We know that from experimental and toxicological studies. We can learn how genes work through something that we call epigenetic marks. And the way that epigenetics marks work is that there are some signals in the genes, in the DNA, that tell which part of the gene should be working at this point in time and in this cell versus which ones are not. And if you want to think of an easy way to understand what this epigenetics means, it's like highlighting in a book. Imagine that you don't have to read the full book. In each chapter would be like a cell. And in that chapter, you only need some information. So that's what this epigenome, these epigenetic marks are doing, are telling the gene how they have to function. And while we cannot change our genes, we can change the way the genes work. And that's what arsenic can do, or smoking can do, or social stressors, even your past. There is information now showing that things that happened to you maybe in early life, or things that happened in previous generations could influence the way these genes are working. And so this is something that is very important scientifically, that people want to understand why, because it could also help us for prevention, for disease prevention. Epigenetics can help us to identify who is at risk of heart disease. And I need to explain to you a little bit about this C index and how we use it. Imagine this C index is 0.5. This is just like flipping a coin and trying to guess if you are going to have a heart attack or not by flipping a coin. That's, half of the chances. But with the risk factor information that we have, like, if we know your cholesterol, your lipids, your diabetes, with all of that information, we improve this risk from 0.5 to 0.7. This is very useful clinically, and that's why the healthcare providers are going to give you statins or give you antihypertensive medication, because they know your risk has increased and you have higher chances. And that's why they are predicting your risk. With these epigenetic marks, with some preliminary findings that we now have from the Stronghorn study, we apparently can predict better to 0.8. So this could be very useful information also clinically. And this is a paper from the Stronghorn study that is currently under review at a very good journal. And if it's accepted, and then it, of course, with replication, with other studies, and science is slow, unfortunately, but we can use this information to also improve clinical care. And, you know, scientists are very naive people. I was very naive. And I thought I owned the data. You know, when I was a student, nobody really explained anything about data ownership. So I thought I owned it. Then I realized that my institution thought they owned the data. You know, I work with Johns Hopkins University, Columbia University. These are powerful institutions. They always make you sign a material transfer agreement if you want to transfer samples between institutions, if you want to transfer data. That's because they really think they own the data. The NIH, the federal government, thinks they own the data because they are giving money. So lots of people think they own the data. But what I learned from working with Strong Heart Study is that all of those people are wrong, and that the communities, the participants who are making this research possible are actually the owners of the data, the ultimate owners. And if we scientists, institutions, and federal government, we can work with those data, it's because there is this agreement that it's possible to work together. There is this trust, there is this partnership. But ultimately, if we don't respect that, if we don't maintain that level of trust and partnership, the owners of the data, who are the communities, who are the tribes, could say, that's it, you cannot do this work. And I've come to respect that tremendously. And I am very, very thankful to the Strong Heart Study communities for teaching me such an important lesson. And I am bringing this picture again because not only Indigenous communities are protecting and safeguarding our environment, they are also protecting us from the abuse, from data sharing done in ways that would not be respectful. And I think it's very important. This resisting unrestricted data sharing is extremely a very powerful action, and it's very important that we respect that and that the communities keep that in charge and keep sharing, but always making sure that you know with whom you share and for which questions and under which conditions. So I want to thank tribal communities for that lesson. And it's very important because I don't know how many of you followed in the last few years, the EPA wanted to have very strict limits on science. And they were saying that they would only accept scientific evidence for regulation, for environmental protection regulation, if scientists shared the private data from participants with them. And that was very scary. That was very scary, that the federal government would be asking us scientists to share our data that we've collected with the permission of with communities, not only tribal communities, any community, any other community, that we would need to share. So the scientists were totally opposed to this. And of course, tribal communities are even more opposed. But this is very scary, that this imposition would be imposed on scientists by the federal government. So in addition to this data sharing, the other very, very important concept is that the data needs to be used to benefit the people who provided the data. And sometimes, unfortunately, scientists use the data for their own benefit, or institutions use the data for their own benefit, but the original providers do not necessarily benefit. And there was this paper editorial published in Nature a few years ago saying that mitigation must be the responsibility of everyone on the planet, not just scientists, business makers, and policymakers, and that Indigenous people must benefit from science directly. And I really like that message, so I put it here. And so how do we make this happen? How do we provide, who is benefiting, and how can the data help? So we can think of how the data can really help locally, for the local communities, for the individuals, individual participants, regionally, and more globally. And for instance, with the information that arsenic is a toxic not only just from Strong Heart, but from many other studies, there was a big investment done in the Pine Ridge Reservation in the Ogallala Sioux tribe to bring in water from the Missouri River. I show you the map from the Missouri River. Bring that water into the OST, into the Ogallala Sioux tribe, and that was a huge investment that has been very important. And I wanted to bring in this picture from Waylon and his effort, because he's doing an incredible initiative to think given the knowledge that we have, that arsenic is toxic, that water needs to improve in communities that remain affected, such as the Hopi Nation. He's really bringing a lesson to the world and helping lots of people to really make a change. And thank you, Waylon, so much for this initiative. And but unfortunately, many families might not have access to community water systems. It might not be easy to connect everybody to a community water system. So thinking of those who have private wells and how we can help those with private wells, we put together the Strong Heart Water Study. Sometimes it's difficult to remove the toxic chemicals from the environment, but there are other things that we can do. Maybe we can improve our diets. We know that if we have better diets, and we know that from also lots of different scientific studies, we are more resilient, we are stronger. This also gives us a lot of strength to deal with toxic chemicals. So thinking of traditional diets and elements of the traditional diet that might be healthy, and like the beans, even things like beef, the good products, the peas, vegetables, good products that can help you have a good amount of nutrients and vitamins. And something that is going back to this idea of traditional knowledge, traditional diets have evolved over long periods of time with the wisdom of long-term traditional knowledge. And so those diets in most societies tend to be actually very healthy and balanced. It's when diets become disrupted very fast, that's when then we lose those nutritious properties. And so that's, I think, thinking of how we can leverage that traditional knowledge for improving our diets. This is the work that Mandy Fretz does, and many others in Strong Heart Study, is very important, and it's actually wonderful for environmental issues too. So we need to work together, nutritional people, environmental people, because all of these initiatives are what make us stronger, are what give us better health. And I want to finish with a slide where Lyle, this is Lyle Best. He was in the front page or in the New York Times, but this was highlighting another important problem. I've talked about water today, but air pollution, what we are doing to our soils and ground through fracking, extraction of gas and oil, it's very important. And it also has major implications for climate change, for health, for our ecological environment, for our human health. Thank you to the Strong Heart Study, because your engagement and your participation is what makes science possible. And please continue contributing to the research questions, contribute to the conduction of the research. As scientists, we need to explain better that sometimes things are slow and change is slow in the scientific speed, but we need to be engaged. And that's our responsibility that we have. We cannot just do the research and then say goodbye. That's not acceptable. That idea of helicopter science is not acceptable. So as scientists, we need to do the research and remain connected and think of how we solve the problems also.